some things have changed. The first thing I think that's changed since those days is that, I'll say the public, but I really mean families, people, even kids, have a better understanding of how the system works. Not a great understanding yet, that's our fault, I think, for not doing a better job of educating. And are clearer around what they need. Their expectations are clearer, they have access to more information, and I think are more, it's not even able, because able was always there, but more willing and know how to participate more in the system. And so I think they're allies in the fight, and that's probably an important first partnership. The other thing that's happened that I think is different is we can't rely on hospitals. No disrespect, but they aren't there. I was at the OHA AGM, and really, I don't want to say how long ago it was, but when I started nursing, it was a long time ago, people were in the hospital for the diagnosis, the workup, the treatment, whatever it was, and the rehabilitation and the recovery. So when you left the hospital, you went back to work, if work was where you went. Can you imagine trying to do that now? So the hospitals are not there for us in the way they were. And of course, while we were doing that, we did not build the community and home sector like we should have. And it has been number 2. So like Avis, it's had to try harder. So I think that's what it creates some pressure. And the third thing is, I know we were talking about measurement and whatnot, but we have made some strides, at least in knowing that measurement is possible, that we really need to at least try to articulate, because I don't want to, before I sit down, I'm going to show you 2 quotes I keep in mind all the time. So I'm not going to overemphasize measuring. Sometimes measuring is damaging because it tells a picture that doesn't describe the experience of the person who we're trying to help. But we are better at all of that. And the other thing I think we're getting better at is standards. So we do have more best practices, and we do have more ways of defining and articulating what we want. So those things are different, and they give me a little bit of optimism.